Hello, welcome to NHS Dorset training. We're going to go through hints and tips for being successful on Facebook and how you can get the most out of your social media account. Why should your practice have Facebook? Facebook is a good way to interact and engage with patients and organisations and build relationships by sharing messaging. It's used to share information in real time. It's a good way to share information and in a controlled way. For example, if your phone lines are down and you need to get the message out. It connects people and it starts conversations. It allows patients and the public to engage with you in an open environment. It can help reduce phone line traffic. If you receive lots of queries about specific services, you can post about these on Facebook regularly to help reduce the amount of queries coming through to the practice. This is also a good opportunity to highlight the services available at the surgery. Community interaction. It brings local people together and starts conversations. It allows your audience to interact and support each other. This is a good reason for keeping comments on posts turned on. It can be a trusted source of information. People trust information coming from the NHS. Facebook account. Here we're going to cover how to make sure your account is set up correctly. Some ways of making your account as successful as possible is to make sure your profile picture and cover photo is up to date. Your bio, which lives underneath your profile picture and is one of the first sections people will see when they go on your page. The first bit of information in your bio is your intro text, informing your audience about your practice. For example, our bio for NHS Dorset is supporting people in Dorset to lead healthier lives. It's important to make sure your bio is up to date and has office hours, your telephone number, email, direct link to online consultations, and your website. Feed. The first thing you'll see once you open up Facebook is your feed, which is made up of the most recent posts from the Facebook users you'll follow. This is where most of your sharing and liking will take place. It's important to start following people straight away so you've got something to read, interact, and engage with on your feed. The feed is useful to see what other accounts you follow are sharing and posting. Facebook post. Each user has a profile they use to post from where they can send out messages to their followers. You can add in images and videos to your post, as well as emojis to make it more engaging. Posts can be a great way of letting your audience know any public information messaging, such as any clinics you have taking place, how to access services, for example, booking an appointment online, if your phone line is down, if you're closed on a particular day for a staff training day, if you have an event taking place that you want to promote, as well as any other more general information, such as campaign messaging, which may be beneficial to your followers. We also use a free Canva account to create images for messaging that we put out. We will send out more information about this after this presentation if you would like to find out more information about this. Sharing a post. This is when you share someone else's post. You can post with or without a comment, but we would always recommend posting with a comment as this is far more engaging. If you were to share this post, for example, you could add in your own messaging about hypertension, such as, we have a blood pressure machine in our reception area where you can get your reading. Like. This is when you like someone else's post or they like yours. It's a positive action to take between people and pages. It's good for engagement of your page as it shows you're an active account. Following accounts. Following is a good way of building your Facebook account and in return getting follows back from relevant accounts. People interact on Facebook by following each other. You can follow people you are interested in and likewise you can be followed. To find accounts, there's a search function at the top of your page where you're able to search for accounts that you are interested in. You can follow pages and you can also add people as a friend. The difference is you follow pages, for example, businesses, celebrities, news outlets, and you add as a friend is for personal accounts, people you know that you want to connect with personally. Mention. This is a way to reference another user by their account name in a post, also known as a handle. You can do this by adding @ before typing in the account name. Their name should appear as you type and you will then be able to select it. This will then notify whoever you mention. Mentioning an account will also alert them of your post, which may lead them to sharing your content and reaching a wider audience. An increase in followers can also arise as a result of this. If you have a public awareness post to get out, for example, your phone lines are down or you're running a screening clinic and you don't have many attendees, feel free to tag @NHS Dorset in the post so we can share to our channels and audience.
Direct message, also known as a DM, is a private message between two users, just like a text message. These messages will appear in Messenger within Facebook. Direct messages are a great way to speak to somebody privately about an issue they may be experiencing, or if they have to share private information with you. For example, this individual asked us how they can get their NHS COVID pass. Here is a list of pages to follow on Facebook if you aren't already doing so. It's a good idea to follow accounts within your PCN, trusts and partner organisations. You can help support each other by following and sharing relevant messaging to grow your community. A hashtag is a discovery tool primarily used on Twitter to find posts based on topics, but it's also used on Facebook. Hashtags are like links. If you click on one, it'll take you to all the posts that have used that particular hashtag. They're a way of getting as many users as possible involved in a discussion or to support a particular topic. For example, hashtag Help Us to Help You is a national campaign on how you can look after yourself to help the NHS. The awareness campaign has covered topics such as heart attacks, lung cancer and cervical screening. It's handy to know that you can embed your hashtags within your sentences. They don't have to sit at the end. For example, there are lots of places in hashtag Dorset where you can get your hashtag COVID-19 vaccine. Hashtags work well when used well. Try not to overdo it, or your post will look like spam. Maximum of 3 per post to make it look tidy. Pictured are an example of a good and a bad hashtag within a post. In the first image, the hashtag won't take you anywhere as it's too long and it's too specific. In the second image, the post looks tidier and flows better with a singular hashtag referring to the campaign. It's good to work out who will be running the account, who has responsibility for it, and how often it will be checked. Ideally, this will be daily so you can check for any comments and messages from patients or members of the public that might need responding to. It would be useful to have the Facebook tab open on your browser so that you can be prompted to check it throughout the day. It's important to have resilience and not just one person who has the login details. That way, if someone's off, others can access the account. It's also important to update passwords regularly. Be mindful when you're posting. We find the best time to post is in the morning between 7 and 9:30 a.m. as people wake up and check their social media before they start their day. At lunch when people are on their breaks, and in the evening when people are at home browsing. We find we get more interaction during these times when people are most likely to be on social media. Doing this can spread out your messaging throughout the day and reach more of your audience. Campaigns are a good way of spreading awareness and helping local and national partners to raise awareness of health initiatives. National campaigns are good to get behind. Public Health England Resource Centre allows you to see all of their current campaigns and material and also be alerted via email when new campaigns launch. These resources are useful and can be very beneficial to your PCN as you can tailor the messaging to suit your audience. For example, the cervical screening campaign. You could tailor this to prompt your patients about cervical screening clinics you may have coming up. NHS Dorset, Dorset Healthcare and Public Health Dorset also regularly have health campaigns going on, so it would be good to get behind these partners and share their campaign materials if appropriate. Paid for ads are a way to get your messaging out to a specific audience that doesn't follow you. You can target your audience and hit demographic, location, occupation, and more. You can see insights and performance data when you run ads, which allows you to see how successful and effective it has been. Politics and religious topics are controversial. It's best to stay away from them altogether on a work social media account because if you share or like anything political or religious, it could reflect badly on the practice and provoke unwanted conversations. Don't use acronyms with your audience and don't assume they know what you mean. Be really clear in your messaging and use plain English to avoid confusion. Speak to them like a member of the public, not a colleague. The approach we take in regards to comments is we leave our comments on and individually moderate each one we receive to see if they contain swear words or are abusive. We have a setting where Facebook hides any comments on our posts that contain swear words, but it doesn't always catch them all. And when this happens, we go in and hide the comments ourselves. Ultimately, it's up to you what your approach is to this, but this is what we do and what we would advise. When it comes to sensitive comments, it's good to know when to take it to a direct message so that no further information is shared publicly. We always go back to the person who's commented to let them know that we have sent them a direct message. This also lets the public know that we haven't ignored them. We're going to run through the main points to take away from this presentation. Facebook account. Ensure your bio, images and contact information is up to date. How to have an effective Facebook account. Post daily, have resilience in your team and make sure social media is covered in their absence. Check the account daily for messages and comments. Look out for campaigns or messaging from other accounts that you can share and support. Hashtags. They work well when used well, no more than 3 per post to make it look tidy. Mentions. Tag relevant accounts where necessary to ensure that you get your message out and reach a wider audience. What to be mindful of. Stay away from topics which can be controversial and avoid acronyms. Remember you're speaking to the public. Campaigns. Get behind them and share when appropriate. Growing your following. Follow local organisations and accounts that are relevant to your practice or PCN. Post at peak times. Instead of posting all at once, spread out your posts throughout the day to ensure your messaging reaches as much of your audience as possible. And finally, comments. Know when to take it private and send a direct message to protect sensitive information. The best way to get familiar with Facebook is to use it as much as possible. Have fun with it and enjoy. Thank you for listening to our presentation. Do you have any questions?